So for this project, we decided to diagnose Alice in Wonderland with brief psychotic disorder. At first, we were going to diagnose Alice with schizophrenia. However, upon further review of the DSM-5 criteria and other research for schizophrenia, we came to the conclusion that Alice's situation fit more with the DSM-5 criteria for brief psychotic disorder. To start the presentation, we are going to further explain what brief psychotic disorder is, and then we are going to explain why we believe Alice should be diagnosed with this disorder. Okay, so by definition, brief psychotic disorder is the sudden onset of psychotic behavior that lasts less than 1 month, followed by complete remission with possible future relapses. For most people, this disorder begins with a marked stressor that occurs in their life, which can include severe stress, the feeling of turmoil in their life, or trauma and abuse, more specifically when they're a child. In certain cases, some individuals experience psychosis with no marked stressor, and the psychosis just takes place. Psychosis can also be present in a mother after childbirth. To have this disorder, an individual must present psychotic symptoms for more than a day and less than a month. This is the defining factor between schizophrenia and brief psychotic disorder. For people with schizophrenia, the psychosis will last their lifetime. The individual must also exhibit one positive symptom, being delusion, hallucination, disorganized speech, or disorganized behavior. They can also have more than one positive symptom. These symptoms cannot be explained by drugs, medication, or another mental disorder. When diagnosed with brief psychotic disorder, the individual can be treated at a hospital or at an outpatient facility depending on the severity. The most recommended treatment includes antipsychotics, benzodiazepines, and psychotherapy. However, patients with brief psychotic disorder fully recover within a month. If it lasted longer, then it would be another diagnosis. Lastly, there is around a 50% chance that the person will relapse and have another episode.
Okay, the DSM specifies specific criteria for diagnosing individuals with brief psychotic disorder. They must have at least one of the following symptoms: delusions, hallucinations, disorganized speech, or disoriented or catatonic behavior. Individuals with this disorder must also have an episode that lasts at least 1 day but less than 1 month. And lastly, the patient has to return to their premorbid level of functioning to be diagnosed. The diagnosis of brief psychotic disorder often comes after the psychotic episode has ended, but it is important to diagnose because relapses are common with this disorder.
Okay, so since brief psychotic disorder has an extremely low incidence rate, there is not significant evidence about the biological, social, and psychological factors that contribute to the development of the disorder. However, there is a lot of significant research on schizophrenia that can provide insight into possible factors that contribute to brief psychotic disorder, since they have similarity. So the biological factors evidenced are twin studies, adoption studies, and family prevalence that show a strong correlation between heredity to psychotic disorders in general. In a twin study research, it was found that the concordance rate, or chances of both twins having schizophrenia, was 28% in identical twins and only 6% in fraternal twins. This provides evidence of a genetic component in psychotic disorders. In an adoption study, it was found that children born to mothers with schizophrenia and then placed in a foster home within the first 3 days after birth had a higher incidence rate of schizophrenia as young adults than a control group. Lastly, schizophrenia and psychotic disorders are more common in people who have family members with psychotic disorders, mood disorders, and personality disorders. So for the next part, I decided to put the psychological and social factors together. So the psychosocial factors highlight how the environment plays a role in triggering a psychotic episode. These factors include socioeconomic status, family influence, trauma, abuse, immigration, turmoil in one's life, and the death of a loved one. People who are experiencing economic difficulties, poverty, or homelessness are at a higher risk of developing a psychotic disorder. Another factor is the family dynamic in a household. It is found that hostile family environments with a lot of criticism and emotional overinvolvement can lead to children developing psychotic symptoms. One of the main triggers for a psychotic episode is a traumatic or abusive event. This is especially prevalent in children. A person who experiences being physically and sexually assaulted is at higher risk for psychosis. The fourth factor is immigration status or cultural identity. It is found that people who have recently left their country or are considered a minority are more vulnerable to psychotic disorders because of the large amounts of stress in their life. The fifth factor is when an individual feels that their life is in turmoil. This can include facing significant life changes like marriage or having a children or going through the death or experiencing the death of a loved one. Having any one of these factors does not mean one will have a psychotic break or disorder. They are just more at risk. Oh, this is Megan. When it comes to psychotic disorders, there are not really any visual signs that help diagnose an individual. There's no physical traits because this is a neurological issue. Instead, there are positive and negative symptoms that display the diagnosis or help diagnose these patients. So the term negative symptom describes a lessening or absence of normal behavior and function. And the term positive symptom describes the addition of something that changes normal behavior and function. A positive and negative symptom has nothing to do with being good or bad. For brief psychotic disorder, negative symptoms include struggling to take care of oneself, having a restricting range of emotion, a lack of goals, and speech impairment. The positive symptoms include delusions, hallucinations, disorganized speech, unorganized speech, or catatonia. Catatonia is when a person is immobile in stupor. The positive symptoms that Alice displays is visual hallucinations. Alice hallucinates a place known as Wonderland that is filled with talking creatures, and she hallucinates the ability that her body changes shape. Alice also exhibits grandiose delusions by believing that she was the hero that saved Wonderland. She also would mention having to complete 6 impossible things before breakfast, as described by her father. A negative symptom that Alice exhibits is struggling to take care of herself. It always seems that Alice is a mess and is never put together. Alice always struggles with being on time, wearing the right clothing, and lacking manners. Some associated features of brief psychotic disorder can include social withdrawal, emotional disturbances, suicidal tendencies, disturbances in daily functioning, and loose associations. Social withdrawal is when a patient is going through a psychotic episode that tends to avoid close relationships to become more connected with their fantasy world, as displayed by Alice. Emotional disturbances are when patients appear to lack emotion or have inappropriate emotions and reactions to their environments. Suicidal tendencies are very dangerous and important to look out for with patients in an acute and disturbed state of mind because they are at high risk. It is also important to look out for self-harm, as that is an indicator of suicidal tendencies. With disturbances in daily functioning, patients may display unusual movements and immobility that interfere with motor functioning skills. Lastly, the loosening of associations is when the patient seems to lose their train of thought when speaking.
So we think Alice has brief psychotic disorder because of the vivid hallucinations she experiences while claiming to be in Wonderland. Alice's psychotic episode was triggered due to a couple of factors, stressful life events and sleep deprivation. Because Alice shows stressors that triggered her psychosis, she would be diagnosed with brief psychotic disorder with marked stressors. Alice is under a lot of stress in the movie just before she enters Wonderland, including getting engaged to someone she hardly knows and her mother pressuring her to get engaged because it's what's best for the family. Alice expressed multiple times how much she didn't want to be engaged, but it is still under pressure from her mother and society to do so. Additionally, throughout the movie, Alice experiences bad dreams every night that wake her up, causing her to be sleep deprived, which is a trigger for brief psychotic disorder. Lastly, Alice shows some evidence that she experienced an episode of brief psychotic disorder when she was younger, right around the time her father died, because that was when she first visited Wonderland. Further proving Alice's psychosis, because individuals with this disease have a 50% chance of relapse. So we don't see a lot of Alice's father in the movie, but we know he was a dreamer, had a big imagination like Alice, and spoke about Wonderland like he had been there himself. He also has a famous quote saying, "All the best people are mad." And because of this evidence, we think Alice's father might have also had schizophrenia or brief psychotic disorder and may have genetically influenced Alice to also have the disorder. Environmental risks would include Alice's unwanted engagement and pressure from her family and society to be married. So treatment for this disorder has a fairly good prognosis when compared to other psychotic disorders. Treatment for brief psychotic disorders would include medications and psychotherapy. Antipsychotics are the first line of treatment for brief psychotic disorder, and an individual with this disorder should continue to take their medication 1 to 3 months after their symptoms stop. Some common antipsychotic medications that could be prescribed are benzodiazepines, paliperidone, or clozapine. Individuals with this disorder should also attend psychotherapy to allow them to develop better coping strategies for stressors and to help better prevent relapse. Education about the disorder for the individual and their family should be the first topic addressed in psychotherapy. To prevent relapse, patients should be monitored on a long-term basis and encouraged to continue taking their medications as directed. Lastly, psychotherapies should be altered to fit the specific needs of the patient and the biological, social, and psychological factors that initiated the onset of the disorder. For Alice to prevent a relapse and better handle a relapse if it were to happen, she should focus on these coping strategies: facilitating a strong support system, getting enough sleep, managing stress, and avoiding triggers. Allowing Alice to build a strong support system would help her have people to rely on if a relapse were to occur. Alice's mother and sister are people she could use as her support system because they both care about her and they would help her through an episode. Additionally, Alice could be prescribed medications to help her sleep or take melatonin to avoid the sleep deprivation risk factor. In psychotherapy, Alice would learn stress management techniques that would allow her to be able to better manage stressors in her life and decrease her risk of relapse. Lastly, Alice needs to avoid her triggers, which she is already doing with her other coping strategies, like taking the melatonin and managing her stress. And these will allow her to be better able to cope with this disorder.
And also our citation list, we put in another slide, and we're just going to attach it when we turn this in. Thank you so much.
Bye.